5 favorite things, but the 5 top things, they're my favorite, for decreasing pain and inflammation in the body. I'm Dr. Natalie Gonzalez. I practice integrative and functional medicine. Integrative means that I use the best of alternative and conventional medicine to optimize somebody's health. And functional means that I look for the root cause or the underlying reason that they have a health condition. And I work at it from that point of view rather than just putting a Band-Aid on symptoms. This morning we're going to talk about pain and inflammation, and I say it that way because they often, very often, go together. But in reality, almost all chronic conditions in medicine that we treat, for example, all heart conditions, autoimmune disorders, diabetes, cancers, all of the main things that we treat, the underlying root cause is going to be inflammation. And if we can regulate inflammation in our body, we will have a much better system to make our way through this life. So I know this is a lot of information that I give in these videos. I'm going to try to break it down so that this week you may not learn anything from this video, but you may be reminded of something that you can take forward into the next week and really try to optimize that very thing. Just take one thing at a time and be comfortable with that. Be comfortable with the fact that you just made a little bit of progress in 7 days. And that's very easy to do if you just take one thing at a time. And once you have that success behind you, then you can look at one of the next things that you may have been overlooking for a while. So let's put it in a framework. The usual framework that I use in my practice is to deal with it from all the different major areas of lifestyle. So we're going to deal with it in terms of food. We're going to deal with it in terms of movement, sleep, stress. And there are some other things that we deal with depending on the specific health condition, but I'm going to try to give you 5 things. And let's get started with food, because food, I had to break it down. Food is such a major topic, and the first thing I would say with food is that one of the most familiar things is that sugar causes inflammation. And if you just keep that in mind, the more you pour sugar into your system, whether it's in the form of honey, maple syrup, white sugar, corn syrup, any of those things, white flour, those white flours and starches break down to, all they are chains of sugar molecules, all glued together. So white flour and heavy starches like even potatoes can be very inflammatory. And so there are a lot of foods that are inflammatory, but the easiest category to think about is sugar. And then to start to back off on that a little bit if you are experiencing a lot of pain, because that's just a sign that you have a lot of inflammation in your body. Whether it's one joint that bothers you or multiple joints, or whether it's muscle pain, pain all over, it could be headaches. All of these things are a sign of underlying inflammation, and sugar will be one of the easiest and most accessible ways for you to downregulate that pain and inflammation in your body. If you have any of these other diseases like cancer or heart disease or autoimmune disorders, then downregulating inflammation in the form of sugar first is where I would start. The second most common one that people don't realize, and that we have a lot of information on the internet that is not based on research evidence, and that is protein. We often think that more protein is better, and if a little protein is good, a lot is better, and there's nothing more untrue about that. There is a limit to how much protein our body can manage without it creating inflammation. And you need to get out there and find out what your limit is for your ideal size. So if you know that your ideal body weight is, and you can go on the inflammation, especially there are some calculators out there for determining your ideal body weight, and there are some charts, and it'll give you an upper limit and a lower limit. If you want to work with the upper limit, you go right ahead. But my suggestion would be to kind of take something in the middle to start with, between those two upper limits on the chart for your height and determine your ideal body weight. And for that weight, if you're doing it in pounds, multiply the number of pounds for your ideal body weight by 0.6. 0.6, you can go as high as 0.8 if you want. If you're doing it in kilograms, multiply your ideal body weight in kilograms by 0.8. You can go as low as 0.6 and as high as 1 if you're recovering from surgery or trauma, but otherwise it should be 0.8 at the upper limit. And anything, you multiply it by that number, and that's the number of grams of protein that you need each day. Now, if you're like my sister, I have my parents, especially my father who's dealing with a cancer, I have him regulating his protein level to those numbers that I just mentioned. But my sister said, if he's eating plant-based food, where is he going to get protein? And that's a really common misconception, is that plant-based food has no protein, and that is anything but true. So if you really start to figure out how much protein you're getting in your whole food plant-based diet, you will find that you are getting plenty of protein. If you're eating grains, beans and legumes, nuts and seeds, and even fruits and vegetables have protein in them. Sometimes far more than I expected. So, I just feel like if that's something that I'm just learning, or I just am becoming aware of, that probably the general population is even less informed, because I'm basing it on the research. So figure out what your protein needs are, stick to those so that you're not overfeeding your body with protein and creating inflammation. The third thing is, let's talk about movement for a second. Movement, we used to think, oh, if you have arthritis, then you shouldn't move very much. We should slow down and pay attention to pain and just not move. And that does not work that way. The less you move, the more inflammation you create. So if you are sedentary, you are creating inflammation by sitting for long hours of the day. This is one that I really struggle with, because I do a lot of things while I'm sitting, a lot of thinking and reading and studying, and I have to force myself to pay attention to a set alarm and get myself up and moving. I have to do a lot of things in a standing position that I might have otherwise done sitting. So sitting will create inflammation. Just not moving and storing fat tissue is inflammatory. It's highly inflammatory. So if we are creating that in our body, we're going to have more inflammation. The other thing about pain, and this is pain and inflammation, and movement, is that when you are moving, you are also creating your body's own endorphins, your body's feel-good chemicals, and your body's own opioids, so your body's own painkillers. So you need to be moving to lower that degree of inflammation and pain in your body. It's very effective. I notice on the days that I don't have time to exercise and do something like a brisk walk or a brisk workout that at least gets me out of breath for about 10 minutes, that if I go for several days like that, I have much higher level of pain and inflammation in my body that I have to do something about. Let's talk about sleep. Sleep is, I need you to think about sleep as a regulator of your immune system. So, a regulator of your body's ability to fight infections and cancers, and whether it's a bacterial infection or a viral infection, or it's a cancer, or it's some kind of neurologic disorder. Neurologic disorders are often have as an underlying source of their cause, or an underlying root cause, is inflammation, because it creates inflammation which causes abnormal proteins in the body, especially in the brain, and then we will see things like Alzheimer's. We will see things like Parkinson's. There's Lewy body dementia. There's a lot of different types of dementias and inflammation in the brain. All of the mental health disorders that people know about have as their underlying reason often have brain dysfunction in the form of inflammation. And things like paranoia and hallucinations and delusions, so much of the time I see that the underlying pattern there is still inflammation. So when it comes to regulation of the immune system to help us fight those things, sleep is where that occurs. That's when our body regulates those things. And if you are not sleeping, I fully expect that you are going to start seeing these different problems in your body, whether it's irritability, depression, anxiety, or it's brain dysfunction in terms of dementia and early cognitive dysfunction, early brain dysfunction, inability to focus. Those are going to be telling me there's inflammation going on in this person, and I'm really going to be wanting them to sleep really, really well. If they have a cancer, if they have heart disease, if they have diabetes, autoimmune disorders, I can almost guarantee that you're going to see some sleep disorder there too. And the more we can deal with that and regulate sleep, the more we will find that it starts to control some of that inflammation, and we'll see improvement in those conditions. So, and lastly, stress. What's interesting to me about stress is I always thought, well, how can stress, I mean, we always say stress is involved in so many of the chronic disorders that we see in people and the health conditions. But when I see it clearly in myself is when I have periods of time when I'm highly stressed, when I go from, an ordinary routine of my day that has been going on for several months, and I'm feeling really good, and all of a sudden I have a deadline for something, and I have to focus day in and day out on that deadline to meet that deadline, and that increased level of stress going on during that time period, it's almost within a few days that I can tell I ache all over. I'm not sleeping as well, which of course is going to regulate that inflammation also. But it's very quickly that stress, that increased stress, will start to cause such a clear deterioration in my health in terms of increased pain and obvious increased inflammation, whether it's muscle and joint pain or whether it's increased irritability in the brain, all those things. So really taking note of stress, if that's what your main underlying inflammatory cause is. So take these things. It would be either something to do with food. I didn't mention the fried foods and the high levels of animal fat, but that will also increase inflammation. But so just take one of them: food, movement, sleep, stress, and just take one of those this week. Decide where it is you're going to make a change and just focus on that one for the next 7 days and see if you can just make a little inroad with that, a little bit of progress. This is not something that we do immediately. And every time I present something in these talks, a lot of times there's a lot of information. I just wanted you to take one piece away from this, one little gem, and work with it for yourself. If you think this has been helpful for you, sorry, not inflammatory. If you think this has been helpful for you, please share it with a family or friend that you know it might help. And if you don't know who it would help, please just like it on YouTube so that they know to share it with somebody like you who has similar concerns. So take care, everybody. It's our first day of winter here in Montana. We just had a snowfall, and it's starting to turn to a wet snow, and it's supposed to warm up today and melt. But yes, it's a little darker in my little sunroom here this morning, and I just want to wish you a really wonderful day. We'll see you in the next video. Thanks.